Hello and welcome to our fascial fix for TMJ and jaw pain. TMJ stands for the temporomandibular joint, which is your jaw joint, and it's also a shorthand for the symptoms and syndromes that people may suffer from. Very typically, TMJ can cause pain in the jaw, popping, clicking, difficulty chewing and opening and closing your mouth. Associated with that can be pain generally in your face, and maybe even extending into your ears and things like tinnitus. Quite often, the symptoms of TMJ are not easily explained from a medical perspective, and it can be that the problem is actually in part due to your fascia, your connective tissue in your body, which has become too tight and restricted. These exercises can help to start to release some of those restrictions and help to alleviate some of your symptoms. In this exercise, we're going to do a stretch for the side of your neck. To do this, make sure that your arms and your shoulders are nice and heavy and relaxed. And then you're just going to tip your head to the right side so that your right ear comes towards your shoulder. When you do this at home, it's a good idea to start by doing this looking in a mirror, because quite often people start to lift their shoulder up as they do this exercise, in which case you lose the benefit of the stretch. So making sure that your shoulders stay nice and heavy and relaxed throughout this stretch. And so only go as far as feels comfortable for you. If you start to feel pain or discomfort in your neck or your shoulder or your jaw, then just ease back out of the stretch a little bit. The idea is to allow time for the tissues to release and let go. And as you do this stretch, you may feel it more in your jaw or in your ear, maybe in your neck or even in your shoulder or your arm. Wherever you're feeling it, it's absolutely fine. Just allow time for things to release and let go. If you feel you would like a deeper stretch, then bring your right arm up and place it on your head. So it's not pulling your head, it's just allowing the weight of your arm to create a slightly deeper stretch. And as long as you're here for at least a couple of minutes, then the tissues will start to release and let go. Then coming out of the stretch, just give your shoulders a little roll, just to loosen and assimilate the stretch. And then we're going to do the other side. So bringing your left ear over towards your left shoulder, making sure that your shoulders stay nice and heavy and relaxed. And just allowing time for the tissues to release and let go. And wherever you feel this stretch, that's fine for you. The longer you do the stretch, the more it will start to spread throughout your body. And in order to create a deeper stretch, you can bring your left hand up, place it on your head, not pulling, just allowing the weight of your arm to create a slightly deeper stretch. And again, be here for a couple of minutes to allow time for the tissues, the muscles and the fascia to start to let go. In this exercise, we're going to work on a muscle called the masseter. You have two of these, one on either side of your face. They extend from your cheekbone at the top, right the way down to your jawbone at the bottom. For its size, the masseter is one of the strongest in the body, and it is your main muscle of chewing. If the masseter becomes tight, it restricts the movement of your jaw. A lot of the issues people get with TMJ, TMD and jaw pain generally is caused by the masseter being too tight. It can restrict your opening and closing of the mouth. It can contribute to popping and clicking noises that you may experience. To work on this, we're going to use the pads of our fingers. I'm going to sink them in to the muscle just below the cheekbone. So to make sure that you're in the right place, if you clench your jaw, you'll feel the muscle bulge out beneath your finger pads. So imagine that your finger pads are sinking in through the skin to make contact with the masseter and all the fascia that surrounds it. And once you have that sense that you have made contact with the tissues, very, very slowly start to traction your finger pads down the line of the muscle. The slower you do this, the more the tissues will release. It should take at least a couple of minutes to get from the top to the bottom, and it can take much longer if you find areas that feel particularly painful or tender on the way. Quite often you'll get to a point on one side and it can feel like a tender spot, and that's a trigger point. And it may start to refer pain or other symptoms into your jaw or your face or your ear or even up into your head. So if you're on a trigger point, just wait. Wait until you get a sense of it starting to ease and any tenderness starts to reduce. And then continue on your journey down the masseter until you reach the jawbone at the bottom. As I say, this can take at least a couple of minutes. You can do this 2 or 3 times. And by doing this exercise, it really helps to loosen your jaw. And many people start to notice that they can open and close the jaw much easier as a result. So we continue down until you get to the bottom where the jawbone is. In this exercise, we're going to do a throat stretch. So to do this, you can either do it through clothes or you can do it directly on skin. Sometimes working directly on your skin means that you get better contact and traction. So you can experiment at home to see what works best for you. So you're going to cross your hands, place them on your chest just below your collarbones. So if you imagine the palms of your hands sinking gently through your clothes, through your skin, and making contact with the tissues underneath. So don't worry if you don't actually feel that, but just imagine it, because the more you imagine it, the more it will start to happen. And so you may start to feel that the tissues are a little bit softer under your hands. And you can then start to allow your arms to be a little bit heavy. So as that happens, they'll start to pull slightly down towards the floor. So you're not aiming to move your hands, but you're aiming to get a sense of traction of the tissues in your chest being gently pulled down towards the floor. And from here, you can then tip your head back slowly, only as far as feels comfortable. If this makes you feel dizzy, then keep your head level. And just allowing your throat to start to stretch, and you'll get a sense of stretch that comes up from your collarbones, up through your throat and into the bottom of your jaw. And this is an important area because there are tissues, muscles and fascia here that can get very tight and can restrict the movement of your jaw. So some of the pain that you may get with your jaw and your TMJ can be coming from this area, particularly if you get a sense of restriction in your throat when you swallow. And as you're here, if it feels comfortable, you can turn your head to the side. So if we turn to the right, first of all, and you should feel a stretch start to come up the left side of your neck and your throat into the side of your jaw, just below your ear. And just allow time for that to start to release and let go. And as that feels softer, you can then slowly turn your head to the other side. And again, just allowing time for the tissues to soften and release. And this time you should be feeling the stretch coming up into the right side of your jaw, just underneath your ear. And just allow that to soften and release. So this can really help, particularly if you sometimes have that feeling of restriction when you swallow or when you breathe. And this just helps to open out all the tissues internally in your throat. For more information about TMJ and exercises that can help, why not have a look at our Living Pain Free All About class for TMJ and jaw pain. You can find this on our website.